Communicating Online Health Promotions to Culturally and Linguistically Diverse Youth. This presentation discusses online health communication challenges for CaLD youth due to language barriers, cultural differences, and limited digital literacy. It focuses on sampling techniques, data collection methods like interviews, surveys, focus groups, and ways to address these challenges. Theoretical considerations include the use of established theories and models to guide the study, controlling variables, identifying biases, and generating insights for marketing strategies and decision-making. Some of the key considerations are cultural and linguistic diversity are essential for understanding online communication practices. Empowering participants and addressing power imbalances is crucial for cultural sensitivity in communicating health information. Selection criteria transparency and a diverse sample help minimize bias in findings, as noted by Shreya in her cyberbullying research. Practical considerations impact study feasibility and quality. Addressing these ensures rigorous research aligned with business needs. Some of the key practical considerations are access to technology. We need to ensure the study is accessible to participants who may have limited internet access or primarily use mobile devices for social media to ensure inclusivity. Address language barriers. Ever's research paper about sexual health communication emphasizes using appropriate languages and culturally sensitive consent procedures. Recruit a diverse range of participants. To ensure diverse representation and valuable insights in researching, O'Mara and Wild in their research papers recommend using purposive or snowball sampling techniques. Ethical consideration in marketing research prioritizes participants' rights, well-being, responsible conduct, transparency, and confidentiality. The key considerations are clear communication and language accessibilities are vital in obtaining informed consent from CaLD youth. Wild's study reported 97% participants understanding the procedure of gaining consent, while in a similar study by Evers highlighted the significance of written and verbal explanation for consent. Addressing power dynamics is crucial in research. Creating a safe environment fosters open communication, as shown by Wild's study in health promotion where 91% felt comfortable sharing their opinions. Respecting privacy and confidentiality is vital in conducting research with CaLD participants. Swiss's paper on social media on young people found that 94% considered protecting personal information essential to the study, promoting trust and participation. Differences in sampling young people from CaLD background versus adults and general population. Sampling for CaLD youth in online health communication requires additional considerations compared to general public sampling. Here are some key differences. Language diversity is important in research. In a study by Lee, only 53% of Chinese-speaking participants completed a health survey in English compared to 94% of English-speaking participants. Cultural sensitivity is essential when sampling CaLD youth as their cultural norms and beliefs significantly affect their online communication behaviors. In contrast, general public sampling may require varying level of cultural sensitivity. Tailored recruitment strategies are necessary for sampling CaLD youth, such as partnering with community organizations, participating in cultural events, and using relevant social media platforms for diverse representation and active participation. Parental consent is crucial when sampling CaLD youth due to cultural expectations of parental involvement in decision-making and research participation.
Data collection methods. Some common methods to gather data on CaLD communities' attitudes towards social media are in-depth interviews. This method is detailed and gets personalized responses from participants. Can be conducted in the participants' preferred language. Offers flexibility in scheduling and location. Researchers conducted in-depth interviews with 25 young people in Australia to gain more insight into their attitudes and experiences with online sexual health information. However, it is time-consuming and resource-intensive. Also, it is not feasible for large sample sizes. Online surveys reaches a large and diverse sample quickly and efficiently. Provides a level of anonymity that encourages honesty, cost-effective and allows for easy data collection and analysis, but may have lower response rates than other methods. This method does not allow for in-depth exploration of participants' views and experiences as well. Focus groups. This encourages discussion and interaction among participants, provides insight into cultural and linguistic nuances, allows for in-depth exploration of topics. A paper on social media use for health promotion used focus groups to explore experiences of 30 CaLD community leaders. They found unique cultural and linguistic factors that influence their social media use. Some cons are that results can be difficult to generalize to a larger population, requires a skilled moderator. Some participants may be hesitant to share their views in a group setting due to cultural or social norms. Next is ethnographic research. This type of method provides a more immersive and holistic understanding of the target's population, behavior, and culture. Reveals insights that would not be apparent through other methods. Provides rich data that can inform marketing strategies. But it's a little time-consuming and resource-intensive. Requires specialized training and skills. May face challenges in building trust and rapport with the target population. Researchers studying COVID-19 health information used participatory research approach involving community leaders and stakeholders to co-design the research process and engage participants. Conducting marketing research with young people from CaLD backgrounds presents several challenges. One is language barriers. Difficulty in understanding questions and expressing themselves. Platforms like Google Translate, Duolingo, and Babel can help bridge language barriers by providing translation services and language learning resources. Cultural differences. Differences in values, beliefs, and practices that may affect the research process. Online resources like Culture Wizard and Hofstede Insight provide information and resources on cultural norms, values, and practices that can help researchers navigate cultural differences. Limited access to internet and technology required for the research. Zoom, Skype, and Google Meet can help researchers conduct remote interviews and focus group discussions. Privacy concerns. Fear of sharing personal information due to cultural and religious beliefs. Platforms like SurveyMonkey and Qualtrics offer anonymous survey options that can alleviate privacy concerns. Ensuring ethical and informed consent is obtained from participants from diverse cultural backgrounds. Websites like Ethnio and ConsentKit provide tools and resources for obtaining ethical and informed consent from participants from diverse cultural backgrounds. In conclusion, conducting inclusive and participatory research with young people from CaLD backgrounds is essential. To do this, researchers must respect diversity, address barriers, obtain parental consent, and use appropriate data collection methods. Through this approach, researchers can better understand and overcome challenges in online communication research.
Thank you for watching.